Relocating to Australia is an exciting adventure for any family, but when your child has ADD or ADHD, there's an extra layer of preparation to ensure their healthcare and medical needs are met without disruption. At SDC International Shipping, we help parents plan every detail of their move, from packing toys and school supplies to navigating Australia's strict medication import rules. Here's why preparation is critical for ADD and ADHD medications. Australia classifies most ADD and ADHD medications as controlled substances. That means they can only be imported for personal use in limited quantities and with the right documentation. Arriving without proper paperwork can lead to delays at customs or worse, seizure of your child's medication. Since overseas prescriptions are not valid in Australia, you'll need to transition to a local doctor soon after you arrive. Having complete records makes this process smoother for both you and your new healthcare provider. Here's what your doctor's letter should include. Before you leave the U.S., ask your child's prescribing doctor to prepare a formal letter and a copy of each prescription. For the medications that you're going to bring, this should be an official letterhead and in English. It should list the name of the medication, including any generic names, the dosage and the strength, the quantity you are bringing, a statement confirming it is for personal use, and confirmation that is legally prescribed for your child. Here are best practices for traveling with ADD, ADHD medication. Keep all medication in its original packaging with pharmacy labels intact. If your child has a chronic condition, ask for a health summary that includes their diagnosis, medication list, allergies, and treatment history. If you're carrying any injectable medication or medical devices, which are rare for ADD, but possible if you have coexisting conditions, make sure your doctor's letter mentions them specifically. And bring copies of previous medical records, which will help your Australian doctor understand your child's history and continue care without interruption. Here are some special requirements for controlled substances. ADD and ADHD medications fall under Schedule 8 drugs in Australia, meaning extra care is required. You can bring up to a 3-month supply for personal use, but it has to be declared at customs. Additional import permits may be required depending on the specific medication. Your Australian doctor will likely need to apply to state or territorial health authorities for permission to continue prescribing the medication after you arrive. At SDC International Shipping, we guide families through these steps so nothing is left to chance. Here's how SDC helps families moving with children who have ADD. We understand that for kids with ADD, consistency is key, not just in medication, but in routines, environments, and support systems. Our relocation coordinators help you plan medication quantities and timelines so you don't run out before seeing a local doctor. Provide custom guidance and checklists so you arrive with every document needed. Coordinate shipping to household goods, school supplies, and comfort items are ready when your child arrives. This helps reduce stress during the transition. Offer local resource referrals so you can quickly connect with doctors, pharmacies, and support services in your new community. Relocating with a child who has ADD can feel overwhelming, but with the right planning, it can be a smooth transition. We'll help you manage the paperwork, timelines, and logistics so you can focus on helping your child settle into their new life in Australia. Call us 877-856-7050 to request a free quote today. Start your family's relocation plan, one that puts your child's health and well-being first.